All right, well, we're a couple minutes past 3 p.m. Eastern, so we'll go ahead and get started. A couple of housekeeping issues that I like to address before we get going. Yes, this will be recorded, and yes, the slides and the recording will be sent around to everyone who registered for this webinar. We'll also pop it up on the Difference Card website at a later date, so it'll be accessible if you want to grab it there or send it along to a colleague or coworker who might be interested in watching the recorded version. Just a reminder, everyone is muted because this is a webinar. So if you have any questions, please use the chat box or the Q&A. We will most likely save all questions until the end of the presentation, and then Emily and Jennifer will go through and answer anything specific that maybe popped up during the course of the conversation. If you have any technical questions, feel free to pop them in the chat and I'm happy to troubleshoot. Okay, with that, let's go ahead and get started. I know we have a jam-packed agenda today, but first I want to introduce myself and our speakers. I am Taylor Britt, Vice President of Marketing for the Difference Card. I've been with the organization for 10 years and I get to do fun stuff like this, like bring you guys really great educational webinars. I'm going to pass it over to Jen to introduce herself.
Well, hello, everyone. I'm Jennifer Revell. I'm here in Indianapolis, and I have the pleasure of being a sales consultant at the Difference Card. I've been here almost 8 years now and cover not only Indiana, but Ohio, some of Kentucky and Tennessee as well. And I'm going to pass it over to Emily.
Hi, I'm Emily Adams. I have been at USI Insurance for going on 13 years now. Have been in the health insurance industry for close to 20, and my passion is really trying to help clients and their employees find affordable and accessible healthcare. So I'm really excited to share one of my secrets, which is the Difference Card, as a way to, especially in the nonprofit sector, to bring better benefits for a lesser cost. So I really hope that you get a little something out of today. And if the Difference Card can help you, we're ready to help you talk about it. Want to get us started. I read a really interesting write-up that Diane Yentl, who's the president and CEO of the National Council of Nonprofits, gave to a recent House subcommittee hearing in DC last month, talking about a lot of the challenges that nonprofits face. And we realize, doing what we do, is that, bringing affordable and accessible benefits and creating, retention abilities and whatnot is just a very small piece of the struggles that nonprofits are facing, especially this year with the challenges that you've already seen with the administration. So, from my perspective as a benefits consultant, a lot of the challenges that we're seeing and navigating for clients that are in nonprofits around benefits really kind of align around mental health and well-being, gaps in care. Of course, HR teams are always, tasked with more and more, and the ability to have to utilize less and less. With Doge, for example, you are needing to provide return on investment and justification for everything that you do. Of course, there's budget constraints. There's a lot of funding that has been lost. And then you combine that with rising healthcare costs. How are you going to be able to continue to attract and retain your people? And then, of course, you've always got in the back of your minds, I'm sure, compliance and risk management, struggles. So, I'm happy to say that the Difference Card is one of the things that's called a medical expense reimbursement plan that we'll run and go through here in a little bit. But it's one of the things that really helps to really go after all 6 of these buckets. So we'll just go ahead and dive right in. Jen, do you want me to go through this one?
Sure.
Okay, so we know that the costs of healthcare in the US just continue to rise, and it is very hard and very time consuming. to bend the trend. Oftentimes in order to really reduce the costs or even stabilize the costs that your company may be seeing, you have to do a lot of small things to make a big difference. And that's hard to do when you're up against all of the constraints that I just mentioned. I mean, this year already, we're seeing double-digit increase renewals, even in self-funded groups, quite honestly. So we, hope that we can be part of the solution and not the problem by, continuing to bring better benefits at a lesser cost to you and your membership.
I was just going to say here too, Emily, just like you mentioned, these renewals that we've been seeing over the last couple of years have just been crazy. I had a coworker in Texas that she was working on a group, they were getting an 89% increase. That's incredible and insane, but we don't think that there's any relief to that on the horizon, so that we really think that these fully insured increases are going to continue to go up at the pace that they've been going up, which is very unfortunate for an employer group. But the good news is we have a solution to that. But I was just going to share that we don't think that there's really any relief to those increases in the near future.
Yeah, I would echo those sentiments in the fully insured market space for sure. Recently, we do an annual benchmarking study every year. It's quite a large study, and I wanted to share with you some of the aggregate information that came out about nonprofits in terms of benefit plan design and cost as we dive into the conversation today. If you have not had your company benchmarked against all of the other nonprofits or similarly size and scope organizations, and you would like to have your benefits benchmarked against that, feel free to reach out to whoever at USI invited you to today's conversation. And I know that they would be happy to input your information in there and give you a really nice side-by-side comparison. But on an aggregate basis, when we're looking at qualified high deductible plans, right now the average, and to remain embedded by our IRS regulations, is to have that minimum $3,300 deductible. So we're really seeing a lot of $3,300, $6,600 deductibles with almost $5,500 out-of-pocket maximum for singles, $10,000 for family. There's 20% co-insurance on average between the deductible and that out-of-pocket maximum. And then you do have, employer HSA funding. I will say in the nonprofit sector, it's higher than in the private sector. The private sector, we're usually seeing about $600 for singles and $1,200 for families. So that was really nice to see. But then when we look at PPO plans, the average deductibles are $1,500, $3,000. You have that 20% co-insurance between the deductible and that $5,000 or $10,000 out of pocket. And then co-pays for drugs on average are $10 for generics, $35 for brand or preferred brand at $70 or specialty. So, for me, I look at this and I think, well, okay, I have a family and, we're unfortunately a family that will forever hit our out-of-pocket maximum because I have a very cute type 1 diabetic at home that no matter what I do to try to mitigate our costs for her care needs, we hit that out-of-pocket maximum. So, $10,000 for a family just to hit the out-of-pocket maximum, plus you add in the premium that people are having taken out of their paycheck on a monthly basis. If you look at that for families, could be almost $1,000 a month. So when I look at this, I look at the amount of medical debt that is out there that I believe is outrageous, and that people are really just trying to get the best care at the best price, but the way that the system is set up right now, and without, interesting and innovative ideas like the one that we're going to share with you today, the costs are just really completely unsustainable. So how do we solve that healthcare puzzle? That the age-old question. You want to pay less for your medical insurance, but still offer the same or better benefits to attract and retain talent. And so, oftentimes and historically, paying for first dollar coverage is really expensive, and it's considered to be unnecessary for a lot of employers. And it's one thing that they go ahead and kind of do away with when evaluated, because they need to reduce the total cost of the spend to the company. Insurance carriers make a lot of money, right? I don't do this because I love insurance. I do what I do because I have a passion about helping others and making sure that they have affordable and accessible healthcare. And one thing that I've realized over the years is that there are a significant amount of people who incur $4,000 or less in total claims. And then you have families like mine that are probably driving, the major cost increases for each of your organizations. So, what's a way to get around that? We'll come up with a couple of ideas for you that we'll share today. But first, I want to go through one of our first polling questions so we can get to know you a little bit better.
Yeah, thank you. Let's go ahead and launch our first poll here. All right. So, really easy question, yes or no. We're not going to make it too hard on you. There's no pass fail on this course. But have you ever had to cut benefits because you couldn't afford the health insurance carrier increase? Yes, no, not sure. Going to keep it nice and easy for you.
We need some Jeopardy music right now.
Right. I'm surprised that Zoom hasn't worked that into
I
the poll
know.
feature.
Exactly.
I'm going to talk to my Zoom rep about it. All right, it looks like we got a good portion of everyone participating here, so I'll go ahead and share the results. We're kind of split. 40% say yes, they have had to cut benefits. Another 40% said no, so they're very fortunate 40%. And then we do have 20% on the call who are not quite sure if they've had to go this route before.
Very fair. All right, well, Jen, why don't we dig into how the difference card works?
Yeah, so thank you, Emily. And that was interesting that it's 50-50 split. I know a lot of times when employers are facing a big increase, sometimes that's the first thing they do. Well, maybe they change carriers, or they change their benefits, or they add a new plan to the mix. So that's all pretty typical. The difference card is a solution that can help with that. We've been around for almost 25 years now. Taylor will have to plan our 25th anniversary celebration at some point, but we've been in the business almost 25 years. You'll see some stats here of the savings that we help employers realize. On average, that's 18%, which is $250 million worth of savings that's out there with the difference card. And we have over 1,500 clients on our books, with over 300,000 members across the country that utilize the difference card solution. And our retention rate is 90%, which we're very proud of, because not only do we want to bring an employer group on with the difference card and help them save money that first year, but to continue to help them save money over time. And here's how the solution works. And Emily mentioned it's a MERP, it's a medical expense reimbursement plan. So that's a lot of words. I say it's because it's medical insurance, we have to have an acronym for it. It's the MERP solution, and that's what we're going to talk about today, is how this works. So you'll see, as a fully insured employer, there's non-refundable premium that you pay to the carrier. In this example, it's $1 million of non-refundable premium. Even on your best year, when everybody's healthy and you're not using your plan, the carrier never comes back to you and says, hey, great year, we're going to give you some of this premium back, right? Once you pay it to the carrier, it's gone, never to be seen again. So we say, let's buy benefits in a more efficient way. Don't buy that maybe $1,500 deductible plan that Emily talked about earlier. Don't buy that plan, but let's buy a more efficiently priced plan with maybe a $6,000 deductible, because we know that not everybody uses the plan. So not everyone uses the plan. So let's not buy that rich plan. Let's buy a less expensive plan and save money by not paying the carrier so much. As Emily mentioned, they make enough money as it is. So let's reduce that non-refundable premium with the carrier by buying a less expensive plan. Again, maybe the $6,000 deductible plan. And then the difference card sets alongside that carrier plan to build back, if not the same benefits, even better benefits. So in this example, where you were spending $1 million of non-refundable premium, now you're saving $178,000 by using the difference card solution. And we'll actually walk through a couple of examples with nonprofits on how they saved with us and what the solution looks like. So there's savings here with the difference card. We'll show you how you actually get to those savings in just a moment. We mentioned a couple things. As you all know, fully insured, that's where, just like I mentioned, you pay the premium never to get it back. The carrier takes on all the risk, and because they're taking on all the risk, they charge for that. On the opposite side of the funding spectrum here is self-funded, and that's where the employer takes on the risk. They may buy what's called reinsurance for those really expensive claims, but they're really funding all of their claims exposure. Well, we sit in the middle of that, and I like to say we're a hybrid between being fully insured and self-funded. You're still fully insured with the carrier, may not even have to change the carrier if you implement the difference card. A lot of my groups don't, they stay with the same carrier. But you're now adding a component of being self-funded on top of that. And so, like I said, it makes it almost a hybrid between self-funded and fully insured. If you work with a consultant and they've talked to you about maybe you should look at self-funding, but you're just not ready to go there, we are a great stepping stone to get to self-funded, because you're going to get a taste for what it's like to be self-funded, but still protected by the carrier for those catastrophic type claims.
Yeah, and I would love to jump in there on
Yes.
that. So I work with a lot of self-funded clients, and for some of my clients that have had that worry, like they just don't feel like they're ready, or their HR and finance teams don't really understand the protections that are a part of self-funding, or it just sounds scary. So they're looking for something that's like a little more comfy, cozy, and in between. Then I often do present a difference card opportunity, because really what we're doing when we're structuring this MERP is we're buying the least amount of insurance possible from the insurance carrier to lessen the amount of money that you pay to the insurance carrier every month, to lessen the amount of profits that you pay to that insurance carrier throughout the year. And then you're reinvesting a lot of that savings back into your employees by giving them first dollar coverage, which is one of my favorite parts about the whole structure of this program.
Thank you, Emily. I get asked this question a lot. Maybe you are offering rich benefits, or you're not sure if they're rich, and you're like, is this a good fit for us? If you're fully insured or you're level funded and you offer benefits, I say even up to like a $3,000 or $4,000 HSA plan, you could still be a good fit for the difference card. It typically works best for groups that have over 25 lives covered by the insurance carrier. And like I mentioned, fully insured or level funded, and you're offering some richer benefits, and you want to continue to offer those. Those are the groups that are a good fit for us. And if you're unsure, then just reach out to the USI consultant who invited you to this webinar, and they'll be happy to work with us to see if it's a good fit. This is just a little bit of information about stats on how the difference card has helped nonprofits over our course of being in existence. You'll see that over the last 10 years, we've saved over $545 million for just nonprofits. I mentioned how big our book of business is, but that is a big number, and I'm really proud of that, because nonprofits are doing work that it's so amazing, the things that they do. We love that we can share this kind of savings. So average annual savings for a nonprofit is over $400,000. And that really equates down to savings for the employee, which is really another cool thing that we can do at the difference card. Is not only are we impacting you as the employer, but that trickles down to the employee saving money and putting money back into their paycheck. So you'll see this average savings per employee per year is over $3,000 with an average savings to them, the employee, of 17%.
The most important part.
Yes. And this is a nonprofit organization in Kentucky, a case study that we put together. They had 162 lives when I met them, and they were facing a 16.1% increase, which they just could not absorb, and they did not want to pass that on to their employees. And what the difference card was able to do is, again, buy less expensive benefits from the insurance carrier. And we actually got them down to almost a flat renewal increase. So instead of 16.1, they were just a little bit above a flat. And that saved them $215,000 that year in the medical insurance. And they were able to repurpose that money and do some really cool projects and put in some things with that savings of $215,000 for that year. And they've been with us for over 3 years now. And so you'll see at the bottom here, their savings over the 3 years is $633,000. So we're so proud of what we've done to help this group. They do some really nice things, have some really good projects. So again, $633,000 of savings in 3 years.
Jen, can you go through how the program worked for them?
Yes. So this is going to show you exactly how this plan is structured for their employees. So we'll talk about member experience in a moment, but this is how we got there. And this is how we were able to generate so much savings. On the left-hand side, you see that their benefits they had when I met them. These are their benefits. They had a $30 copay at primary care, $60 at specialist, $75 at urgent care, $2,500 deductible, and their max out of pocket was $6,500. So we said, let's not buy this $2,500 plan from the carrier. We'll buy the plan in the middle, the space plan, that's a $6,500 deductible plan. And you'll see the copays really stayed the same. The specialist copay jumped up from $60 to $75, but the deductibles where we save them money. So we're now buying a $6,500 deductible plan instead of the $2,500 plan. That's where all that savings came in. But the employer obviously did not want to leave their employees with a $6,500 deductible. So that's where the difference card comes in now. And on the right-hand side, you can see what the member's plan design is with them enrolled in the difference card. So everyone in this plan receives a difference card MasterCard. We put a little purple sticker on there for them to show them how to use it. And in this plan, if somebody walks into the primary care physician's office, they're going to ask them for a $30 copay. Well, they take out their difference card MasterCard. I have one here. They would swipe it for $30 and they would pay $0 out of their pocket. So I love this plan because they now have a $0 copay at primary care. So for general practice and especially pediatricians, they now have a $0 copay for that service. They used to pay $30, now they pay $0 using their difference card. Specialist, they would be asked for $75. They can swipe their card for that $30 and they would pay $40 out of their pocket. Urgent care is $75. They swipe it for that full $75 and it's now a $0 copay as well for urgent care. So they have a $0 copay at primary care and $0 at urgent care, which that drives behavior the way in which you want it driven, right? You don't want people going to the emergency room unless they really have to. So they now don't have an excuse not to have a relationship with a primary care physician or to seek services at urgent care because it doesn't cost them anything out of their pocket. So our card is flexible. We can make this look however you want. That's a conversation you would have with your consultant and with the difference card and how we would structure this. But they really loved giving that $0 copay at primary care and urgent care. Now the member still has a $2,500 deductible. So they have that $2,500 deductible. Once they get through that, if they do, then the employer's picking up the rest of that deductible for them. So they're picking up that last $4,000 of the deductible if they need to. But like we said before, very few people even get to their deductible. So that's where we're helping them save money as well, is that we know not everyone's going to get to that. But if they get to $2,500, Difference card funded by the employer pays the rest of that deductible all the way to the 6,500. And then if they get to that, they have another $2,000 of max out of pocket. So this is a really rich plan for them. And we were really excited about the benefits that we were able to offer them. Not only the savings, but the benefits got better for the employee.
Yeah, and it kind of goes back to my whole medical debt commentary before. I mean, in a lot of situations, you have people who can't afford, or they don't feel like they can afford going to the doctor, whether it's a copay or if you have a qualified high deductible plan and they're having to pay like the full cost of the visit, even though they can put tax-free money aside into their HSA. um, one of the top reasons why I like working with the difference card is it presents an opportunity to provide first dollar coverage to people to make sure that they are getting the care that they need. And it's really kind of fun to be able to design the plan or plans how you would like for them to be designed. So you're not necessarily just looking at a handful of plans that Anthem gives you to choose from, and you have to pick the least of the awful options. Instead, you were picking, a very high deductible plan, of course, because we want to pay the least amount of premium to Anthem or insert any other insurance carrier. But instead, we're backloading, the cost of visits, or, the cost of, like, you can even play around and, cover the full cost of a generic prescription if you need to make sure that people with chronic conditions are taking care of themselves and there isn't a financial barrier to care. So there's lots of different ways to get creative. And we'll share another one with you now that's based on an Ohio nonprofit that Jen helped.
And Emily, what would you say about the member experience? So we have a mutual client that has the card, the employees use it. I think, the number one objection we always hear is we love the savings, but we're not sure our employees will understand how to use the difference card. How has it been for your employees and your employers that have those MasterCards and they can use them at the time of service for things like copays?
Yeah, really, really good. I mean, I'll go back here. You'll see that the difference card puts a little sticker on the top of the card that reminds the individual what the card can be swiped for. So, the content on that sticker will be amended based upon, the plans or the design that put together. But, to be able to have that money right then and there to pay for prescriptions, like, think about at the beginning of the year when your deductible resets. I mean, there's a good amount of panic that it can ensue I hate to keep using like my family as an example, but mid-year we hit our out-of-pocket maximum and I'm like, whew, I'm ordering as much insulin as I possibly can. And it's just like a whole hoarding situation going on over here. And I think other people do that too, in their own with their own care needs. But then that deductible resets in January, and my husband's like, "Oh, dear Jesus, there's so much money going to diabetes." But with the difference card, you have the ability to, use those funds towards those beginning of the year care needs. So people aren't having to make the decision between, do I have the money to spend to go to the doctor, or don't I? And you don't even have to answer that question really. It takes the financial fear out of getting the care that they need out of the equation.
Very good. Thank you. This is, as Emily mentioned, an Ohio nonprofit case study. There's 64 enrolled in this group. They were getting a 3% increase, which a lot of groups would say 3%, I'll take it. I'll hit the easy button and I'm done. But this consultant said, I think we can find you even more savings and give some better benefits. And so that revised carrier premium along with the difference card took them down to a negative 22%, which is incredible. But then we needed to add back in those difference card benefits, and we'll talk about what that looks like in a moment. But this got them to a negative 7.8% renewal with an $85,000 in savings. When again, they almost did the easy button and took the 3%, but instead they now have saved $85,000 using the difference card. And this plan design is really a plan design that we're selling across the country. Difference cards in all 50 states. We sell a ton of this plan design that this group bought, and it's really a good member experience with this next plan design that we're going to show you. And Emily, we have groups together that have this type of plan design that we're going to show here. So this group had copays before. So over on the left-hand side, you see it's a $2,500, I keep saying that, $2,500 deductible plan with copays. They then said, we're not going to buy a copay plan anymore. Let's go to the least expensive plan we can buy with this carrier. And that's a high deductible health plan. And that plan has everything going towards the deductible. So no more copays for the members of this group. Everything is going towards their deductible. But since they've lost their copays, in return for losing copays, we now give them difference card pays first benefits. So in this plan design, difference card funded by the employer pays the first $4,000 of any in-network medical or pharmacy expenses are paid for at 100% by the difference card. Once they get through that, then they would pay that last $2,900 out of pocket. So you'll see this group before, their plan had a $6,600 max out of pocket. So for the employees, they now have first dollar coverage. They no longer have to pay those copays out of their pocket. It's covered at 100%, and their max out of pocket dropped way down to $2,900. So not only did the nonprofit save that $85,000, the members also have first dollar coverage, which is amazing. I usually, if I'm in an open enrollment meeting, I tell employees, go down the street to somewhere else and ask your friends if they have first dollar coverage, and it's just not available anymore. You just don't hear of this type of plan design. This is so rich, and that $2,900 max out of pocket is unheard of for a family. So like Emily, I'm sure you really would love to have this plan design where
Sign me up.
yes, where it's covered at 100% and your max out of pocket drops to that $2,900. And I say this is the easy, while that other plan that we looked at with my Kentucky group was the easy plan design. You have the card and you swipe it. You just have to remember to use it at the doctor's office. This plan is super simple. I say everybody knows how to use a credit card. I think my daughter was 3 when she knew how to use a credit card. And you use the difference card MasterCard just like you would any other credit card in your wallet for this plan design. If you go get a prescription, you take out your difference card and you swipe it. If you get billed later from your provider, well, you can go onto their portal and pay your bill there, or pay over the phone, or pay in a paper statement, just like you would any other credit card. And quite frankly, I tell employees, don't overcomplicate the difference card. It's just a MasterCard with our logo on it. So if a provider takes MasterCard, they'll take the difference card. But like I said, this plan design is super simple. I would say probably 80% of the groups that I'm writing right now have this type of plan design, at least for one of their options. Now, you can't do this on an HSA because we have to have the member paying first. It's IRS guidelines, but the difference card can sit alongside a HSA plan, but we just sometimes have multiple options. Like this group had this option, and then they also had an HSA that they offered to their employees as well. So again, first dollar coverage, max out of pocket, $2,900. Such a nice plan that we're building for these employees of this nonprofit.
Absolutely.
And
Yeah.
I do get asked this question, so I'll just mention this before we launch this. The card is smart. Somebody can't use it at the gas station or Starbucks. It's going to protect the employer's money by only allowing it to be used where it should be.
Good point, Jen.
You're
All
welcome.
right,
Yeah,
our next poll question here. What percentage of increase on your health insurance benefits are you anticipating? Is it 0 to 5, 6 to 10, 11 to 15, perhaps over 15%? I know Jen mentioned that. We've been seeing a lot of groups come in that high. And maybe you're not sure. Maybe it's not time for you to renew. Maybe you're not a 1/1 renewal and you haven't looked at it. But if you do happen to know, we're just curious to see if your trend is matching our trend, which is way up there. We'll give everyone just a couple more minutes to cast their vote here, and then we will share our results. All right. So this is interesting. No, nobody on this call is seeing less than an 11% increase, which tracks with what we've been seeing. And we do have a couple of people who we're not quite sure what their renewal is going to be, but we can tell you it might be somewhere in that 11 to 15% range. But I think this is just really speaks, Jen, to and Emily, to what you guys do to help clients get these better benefits at a better price.
I think so too. Just buckle up, everybody. The
Right.
big renewals are coming, unfortunately.
So at the difference card, the one thing that we do that's very unique, and I know Emily shared with me, she loves this feature. We have underwriters and they look at each of our cases and they will say to a group, if you move to this bigger deductible plan and you're kind of filling in that difference by setting up a difference card plan design, typically it's the CFO will say to me, well, how do you know what we're going to pay? And what if you're wrong? So we're paying out these difference card claims, the employer is, and they want to know, like, what does that equate to? And what if we have a bad year? What if, as my boss would say, zombie apocalypse happens and everybody's maxing out that bigger deductible now and the employer's funding it? What happens? Well, the nice thing is we can guarantee what we expect you to spend with the difference card. And that's backed by a company called Assurant. And Assurant has been around for over 30 years. They're an A-rated insurance company. They've been working with the difference card since 2018, and they really give you a protection so that you know exactly what your worst case scenario is with the difference card moving forward, and there are no unknowns there. So it's really nice because we can offer that protection, especially for nonprofits, right, Emily?
Well, yeah, and then I think I'd like to also let everybody know that, there's like a maximum that, budget basically that you, budget your employee contributions and everything off of. But then there's also a savings return. If you are to perform under budget, then the difference card will provide funds back to you, which going back to what Jen was talking about at the beginning, that just doesn't happen. You're in a fully insured contract. I mean, even if you're in a level funded arrangement, the carrier is really only going to share a portion of the proceeds with you. They're going to try to retain as much as they can. So I do have clients that have renewed with the difference card structure, and they, if they get money back at the end of the year, then they'll roll those funds into their claims fund for the following year. And it just kind of keeps reducing the total expenditure for them. So it's a nice add. That's really all we had for you today. I mean, I hope that gives you a quick peek on, how the medical expense reimbursement program would work. But if you're interested in looking into the difference card a little bit with your consultant, just reach out to whomever invited you. That same individual can put together the 2025 benchmarking study that goes into a lot more than just medical, but I think that could be helpful in your pre-renewal planning festivities as well.
And then Emily, I will say a lot of our time right now in July has been spent kind of looking back at your renewals from 1/1/2025 and saying, if you would have put the difference card in for 2025, this would be your savings. That way we're having the conversation about how this looks for you moving forward. And it's not something that we're talking about in fourth quarter when everybody has a lot going on.
Yeah.
So we're doing a look back on 2025 just to see if it's a good fit or not. We're doing that a lot right now.
Yes, highly recommend it.
Yeah.
Taylor, are there any questions in the chat?
I don't see any that have come through quite yet. So if you do have any questions, now is the time to go ahead and send them over. We've got two experts on the call who could probably answer any question about health insurance, whether or not it's related to the MERP. But feel free to send those over. And while we're waiting for some questions, I did want to note that I dropped in the chat for everyone a link over to the Difference Card website, and we have a whole page dedicated to nonprofits. So if you're curious and you want to dig in a little bit more on exactly the results that other clients like you are seeing, please feel free to hop over there. We've got a lot of resources, some downloadables and white papers and stuff available for you as well. All right. We did get a great presentation from Cindy. Thank you, Cindy. I think they did a great job too. If anyone on the call does think of a question, feel free to reach out to your USI rep, contact someone at the Difference Card. We're happy to get you the answers you might need to explore this solution. But in the meantime, we'll give you back a little bit of your time today. Keep an eye on your inbox. The recording and the slides should go out probably by Monday of next week. So let us get everything uploaded and good to go for you guys, and then we will make sure to get it over to you.
Yes.
All right.
Wishing everyone the best rest of your summer. Be safe out there, and definitely reach out if you have any questions.
Awesome. Thank you guys so much. Take care, everyone.
Thank you.